Hello, my name is Dr. Beth DiNapoli from Otsuka Medical Affairs team. This is part of the Meet the Treatment team series of interviews. So prior to joining Otsuka, I was a clinical psychologist in a hospital setting. So today I'm here to tell you a little bit more about that role. So usually when a patient came into my practice, one of the first questions they had for me is, what is the role of a psychologist on the treatment team? And my response would vary based on what clinic I was working at or what patient type I was seeing, but generally speaking, a clinical psychologist helps a patient cope with various mental and behavioral health problems. And these can range from short-term personal problems to more severe chronic health conditions such as schizophrenia or bipolar. And to do this, a clinical psychologist often uses various assessments and therapeutic techniques that have been shown to reduce symptoms and hopefully increase the patient's ability to function in their day-to-day lives. Psychologists also act as educators, so we provide information and support to the patient's family, and the treatment team. And the aim here is really to increase everybody's understanding about the specific condition or presenting problem and hopefully their ability to cope with that condition. And then lastly, because a patient rarely comes to treatment with just one specific treatment need, it's important that a psychologist collaborate and consult with other disciplines as necessary. So oftentimes I'd have to collaborate with the patient's physician, or I might refer out or consult with other disciplines such as social work. The next question that often came up in practice from patients and caregivers is, what should I expect in that first session and then subsequent sessions? So generally in that first session, I conducted a very thorough interview with the patient. So the patient should come in prepared to answer a bunch of questions, open to the experience and being honest with those responses. So I would ask the patient to tell me what's going on, to describe their symptoms, to explain their current situation, describe the presenting problem. I'd also ask a lot of questions about maybe past psychiatric history, past or current substance use. It was important for me to gain an understanding about their social support system. So what other resources they had available in the community that might be helpful. So their family or maybe their religion. I also gained just some general information about their demographics, health, functional disability, and so on. Sometimes patients are asked to fill out paper and pencil questionnaires, and generally these just ask a lot about potential symptoms the patient might be experiencing. So this gives us an additional information about specific symptoms the patient might be currently having. So the interview is usually done with the patient on a one-on-one basis with the psychologist, but if the patient requests or gives permission, a family or caregivers can also be present, and usually this provides additional fruitful information for us. And the job of the psychologist after this interview is to put all that information together and come up with a working diagnosis. So what's going on? And I say working, it's because it's kind of hard for us to know exactly what's happening just by meeting the patient one time. So sometimes this might change over time. We might refine our diagnosis as we continue to meet with the patient or gather additional information. But from this initial session, usually I can come up with some specific treatment options that might be useful for the patient. If they decide to engage in therapy with a psychologist, they should expect to come back into the clinic to meet with a psychologist on a pretty routine basis. Usually this is once a week, but that can also be variable. So this is one-to-one therapy, but some clinics, like the clinic I worked in, also offer group therapies or caregiver support groups. So be sure to ask about those options as well. And then to end this interview, the last question that often came up is what's the importance of shared decision making? So fortunately in psychiatry or psychology, we have many different treatment options that work. So they are effective for many different conditions. So shared decision making allows us, the patient and the psychologist, to have an open discussion about what treatment option might be best suited for that patient's presenting problem or situation. So as a psychologist, if one or more treatment options are shown to work equally well for that patient's presenting problem or condition, it's my job to present those options to the patient, educate them about what those treatment options are, and then have a discussion with the patient about their treatment preferences. In my opinion, in clinical practice, incorporating the patient's preferences and using a shared decision-making approach is critical. So I've seen that it's really helped with increase that relationship or help, bond that relationship between the psychologist and the patient, increase their therapeutic bond, as well as start off with some great communication. So it allows for better communication as the therapeutic process continues. So that concludes everything that I have for you today. Hopefully you have a better understanding about what a psychologist does on the treatment team. Feel free to check out all the other additional resources that we have available to you on PsycU, particularly the Patient and Caregiver Corner. Thank you very much for listening.